So today we'll be talking about acupuncture and fertility. So this is an analysis of two RCTs, random control trials. So let's begin. The research question that I chose is: women who are diagnosed with infertility, can acupuncture offer them increased fertility? So let's talk a little bit about infertility. And its connection to hypothyroidism and Hashimoto's thyroiditis. So Hashimoto's thyroiditis is the most common cause of hypothyroidism, and they both affect fertility, in particular infertility. Hashimoto's attacks the thyroid and causes damage and suppresses thyroid hormonal function. So Hashimoto's is an autoimmune disease which continuously attacks the thyroid gland specifically. And so how does hypothyroidism affect fertility? So it does this through inhibiting GnRH release, increases TRH levels, and increases prolactin and TSH levels. And so any thyroid dysfunction imbalances the hormones, especially estrogen, testosterone, and progesterone, which all play a key role in the female menstrual cycle. So the effects also Hashimoto's and thyroidism, hypothyroidism have on infertility include insufficient ovarian function, the impairment of egg release from the ovaries, and for the inability for the embryo to fertilize, or if it does fertilize, for it to grow properly and to attach to the placenta. So Western medicine's diagnosis and treatment of hypothyroidism and Hashimoto's. Women will present with symptoms such as fatigue, depression, and weight gain, and there's many more. These are the main ones. And so specific diagnosis methods are testing the levels of thyroid peroxidase, TPO, and also TSH levels and T4 and T3, which are all thyroid hormones. Hashimoto's treatment includes supporting the immune system, lowering anti-thyroid antibodies, and taking selenium and vitamin D supplements. This can all help. And hypothyroidism treatment. So the goal is to harmonize TSH levels, and this requires continuous monitoring and is managed through medication such as levothyroxine. So let's talk a bit more specifically just around the general topic of infertility. So the diagnosis of infertility, but first of all, to diagnose it, it's actively trying for 1 year but unsuccessful. So a couple have to be trying or infertility for IVF for 1 year before they can, and unsuccessful before they can diagnose it as infertility. So 25 to 30% of the population is affected, including male and female factors. Methods of diagnosis will include patient history, physical examination, ultrasound examination, many different hormone and blood testing, of course monitoring the cycle, presenting symptoms, and in more extreme cases or more precise cases, I guess, is examinations such as laparoscopy and some other ones. They're more invasive. So differential diagnosis, of course we mentioned the most common ones is Hashimoto's and thyroid disorders such as hypothyroidism that we mentioned about. but also genetics and age play a huge role. Medication usage, like of course abusing drugs, alcohol, whatever, etc. Cancer, different cancers, um, cystic ovary syndrome, or poor ovarian reserves will all be a contributing factor to infertility. Anyway, so treatment for infertility can include a thing which is called assisted reproductive technology, which is IVF, and there's some other ones. IVF most popular. And another treatment can include ovulation induction, which is the use of a medication oftenly used called letrozole and clomiphene citrate. So Western medicine's strengths and weaknesses. So its strength is its ability to intervene with treatments, such as IVF, of course, can provide surgical intervention, such as polycystic ovary syndrome, and its ability to stabilize the hypothyroid. So yeah, there's a huge key role and link between the thyroid and fertility. So any thyroid disorders is going to affect that. So unexplained infertility so this is a weakness. Unexplained infertility is a very common diagnosis. Provides no Hashimoto's treatment, not any real large Hashimoto's treatment. And unfortunately, unexplained infertility diagnosis makes treatment guesswork and expensive, trial and error, and most emotionally difficult when it doesn't work, like IVF. And complications and side effects, of course, from medications. We know that. So let's move on to the traditional Chinese medicine, TCM perspective of infertility. So we have methods of diagnosis is to first confirm the Western diagnosis, example, polycystic ovary syndrome or Hashimoto's or etc. So discussing in detail the signs, the symptoms, pulse diagnosis, tongue diagnosis, discussing lifestyle, stress, environmental and social factors, and more looking at the whole holistically, the lifestyle of that person. And of course, an accurate diagnosis comes from uncovering the root cause of the ailment, and this is also known as the pattern of disharmony. So some reasons why in Chinese medicine perspective for infertility, some common ones: disturbed Shen, qi blockages, blood circulation disruption, organs involved, liver, controls the menstrual cycle, moves the blood, the kidneys, which is the essence which creates the energy to create that fetus or child, the baby, and also the spleen, of course. Etiology, emotional stress, and constitutional weakness, especially the kidney, essence weakness. So more on, we have differential diagnosis based off deficiency or excess patterns. So some common patterns that we have for infertility can be deficiency yang and yin, kidney yang or yin deficiency, cold in the uterus, blood stasis, spleen qi with damp or dampness in the uterus, liver qi stagnation with damp or heat, or just in general heat, particularly in the uterus. Treatment principles: tonify qi, regulate blood, warm the uterus, support blood in the uterus. And we'll be supporting, throughout the treatment, supporting the implantation of the fetus if IVF, and just in general nourish the growth of embryo. Obviously we have some treatment, TCM treatment, acupuncture, Chinese herbal medicine, tuina, gua sha, cupping, electro, moxibustion. That moxibustion would be good for if there's local points in the embryo, if that woman has cold, stagnation or cold, whatever, in the embryo, in the uterus, and so the moxibustion will help warm that. So we have a little bit of some strengths and some weaknesses. So acupuncture is effective at helping the body restore balance and harmony. And, so if there is an imbalance in any way, or a disharmony in any way, which is causing disease, plus causing the not being able to produce a baby, then Chinese medicine can help that. And it treats the body as a whole and it's holistically, but it's also cost efficient and it's individually tailored based off those patterns of diagnosis. Weaknesses: many treatments can be required, varied responses to treatment due to the different factors. Sometimes it doesn't work because maybe the diagnosis is incorrect, etc. And it's also limited by medical research and studies supporting the effectiveness of acupuncture, unfortunately. So we're moving on to the next section, which is about research analysing these two papers. So this first paper is called Efficiency of Acupuncture Treatment and the Fertility Improvement in Childbearing Female with Hashimoto's disease. And it's a randomized controlled trial. So it did pretty well in the research checklist scores, the consort, stricta, CASP. So this RCT uses 284 women and is split, and they're aged between 20 and 45. So participants split equal parts, so 142 each way. One was acupuncture, one was sham. The intervention, so all acupuncture patients received the same points throughout all of the treatments. Frequency, we have 3 sessions per week for 30 minutes over a 12-week period. So it's 36 sessions all up for each individual patient. And our primary outcome of this first paper is to have the measurements of thyroid peroxide and thyroglobin antibodies, measuring them after week 4, week 8, and week 12, and seeing if they decrease, hoping they decrease. Secondary outcome measurements is measuring the thyroid function, ovarian function, and pregnancy outcomes. There's no adverse effects, and unfortunately this paper did not clearly state these results. It only vaguely mentions them in the discussion section. So strength and weakness to this is the outcome measurements that are specific and precise, and there are a large amount of participants within this study. And what's also cool is they continued this research, looking at the patients for 1 year afterwards. Weakness: results are not clearly defined, and a strength and a weakness, I guess, whichever way you want to look at it, is that every patient had the same point prescription for each session, which could be strength, because and also a weakness. Makes sense. So research paper number 2, we have the effectiveness of acupuncture on pregnancy, success rates for women undergoing IVF. This is a randomized controlled trial also. Again, very similar to the first one we have with the checklist. As you can see there, the design is RCT, and so this one is smaller much smaller, less than half pretty much. And so 76 infertile women undergoing IVF. Ages are similar, 23 to 45. So 36 acupuncture and 36 non-acupuncture. So intervention, different point prescription for each session. And I'll discuss more about the points soon. So the frequency is 3 sessions in total around ovulation. So much smaller in participants and in treatments than the first study. So the outcome measures of primary is the beta CG levels, pregnancy rates, and live birth rates. And the secondary measurement is anxiety levels before and after treatment. So we have the results here. So the beta HCG levels were found in 63.9% of the patients, so 23 of the patients out of 36, and this is in the acupuncture group, and 33.3 in the control group. And beta HCG hormone is produced only during pregnancy, so it's a good indication of if someone's pregnant if they have that hormone available, presented. And also pregnancy and live birth rates were higher in the acupuncture group. There was no difference in anxiety between the groups. However, both groups experienced reduction in overall anxiety. No adverse reactions. Strengths and weakness. The point prescription and treatment protocol were the same for each participant. Clear results. Anxiety scaling, STA1 was used. And a weakness, small number of participants and no control. So here we have the points. For the first one, they use the same one, so ran 6, 17, etc. And then on the second one, 3 sessions with 3 different point prescriptions. So both trials performed well with those scores. Both papers discussed in detail how the trials were performed. So Research 2 had less participants, but followed the patients for a duration of 1 year. Research paper 1 discusses more in detail about the trial, such as the randomization, the exclusive criteria, etc. Research paper 2 uses different acupuncture points for each session, and also within the paper discusses the actions and indications for each point used, which can be helpful. Paper 1 uses 9 points paper 2 uses 9 points for all 36 sessions. Flip those words around for the last 2. Research paper 1 uses different acupuncture points. Research paper 2 uses the same points for 9. Both papers were treating infertile women. However, outcome measures, types of participants, and infertility diagnosis were both very different. Research paper 1, all participants were diagnosed with Hashimoto's. They all had their diagnosis. And the paper in the trial was analyzing if acupuncture is effective for increased fertility for women with Hashimoto's. Paper 2, they were not diagnosed. There was all unknown diagnosis. But the paper in the trial was to analyze if acupuncture is effective for women undergoing IVF treatment and pregnancy success rates. So slightly different. And it's interesting because from a TCM perspective, the undiagnosed infertility would make paper 2's acupoint selection perhaps quite random, because of there is no TCM diagnosis or no Western medicine diagnosis. So perhaps that is why they use a variety of points, and these points are generally known to help with pregnancy, such as the points to help calm the Shen, regulate the uterus, tonify qi, blood, resolve dampness, etc. So the relevant findings, paper 1 provides an in-depth explanation, which is helpful, of the pathogenesis of Hashimoto's. Hashimoto's has no treatment really, besides taking supplements in Western medicine, so there is a large need and a desire for an effective and holistic treatment with no adverse effects. So an acupuncture, fits that nicely. This study is an effective guide for future research also. Paper 2 demonstrates the effectiveness of acupuncture paired with IVF treatment. Size matters when it comes to studies, and this study only includes 72 participants, so more needs to be participating next time, and calls for further research for that, and to, And so anyway, conclusion. Paper 1 clearly declares the link between hypothyroidism, Hashimoto's, and infertility, and discovers the effectiveness that acupuncture has on fertility in women with Hashimoto's. Paper 2 reviews the effectiveness of acupuncture has paired with IVF treatment. And so regarding the research question we had at the start, women who are diagnosed with infertility, can acupuncture offer them increased fertility? I think we can state that yes, it can. And so here are my reference lists, and I appreciate you guys listening.